Today's lesson is we're going to talk about what Medicare actually does pay for and toward long-term care. A lot of folks that come to us and they're talking about long-term care insurance, they're talking about Medicare insurance, they're talking about financial planning for retirement, are under the mistaken assumption that Medicare is going to pay all their long-term care. And the fact is it doesn't. So we're going to show you today exactly what it does pay for. So the first thing is that it's going to pay for a skilled nursing facility, or sometimes folks are going to call this rehab. And either you have or you know somebody that has, where you go to the hospital. Typically this is for older folks. You're in the hospital, and the way they push you out of the hospital is they push you across the street to the rehab facility, and you're there a couple, 3 weeks. Now some folks are there much longer. Some folks are just there a few days. Medicare is going to cover this under some rules, and then of course your Medicare supplement insurance coverage is going to pay. As long as Medicare approves it, it's going to pay as well. And so once you've met all the rules, you're going to get the first 20 days in a skilled nursing facility covered. Now they're going to review you every week, maybe every day, Medicare is, and the staff there, to make sure you're still Medicare certified. And Medicare is going to pay up to 100 days, and they're going to do those next 80 days where you've got some co-insurance and that kind of stuff. But the real issue is whether they approve it or not. So when you look at the average of payment toward nursing homes, it's about 2% that Medicare covers. So that leaves 98% of the nursing home expenses uncovered by Medicare. Okay? For assisted living, which a lot of times folks, they'll use nursing facility or nursing home and assisted living interchangeably, and there's a lot of things about them that are similar. There's no coverage from Medicare for assisted living facilities. Adult daycare, same thing. There's no Medicare coverage for adult daycare. Now for home health care, it gets a little bit tricky, because if they're doing skilled care, or they're performing what is skilled nursing care for you, and you meet all the other criteria for Medicare payment that you would have if you were in a nursing home or a skilled nursing facility, bunch of rules, bunch of regulations, but once you qualify, then it's fairly limited what they're going to pay for. It's part-time care, or a thing called intermittent care, where they're coming in and doing something for you and with you, like physical therapy, that sort of thing. And you need to be homebound. So to get Medicare to pay for it, you can't be able to leave your house. It needs to be ordered by a doctor. If you need more coverage than part-time intermittent care, then you don't even get the skilled portion of this paid for. So in other words, if you need a whole bunch of care, or several hours of care, and you need it every day, they're not even going to cover the skilled portion of that. And there's no coverage for custodial care, which is the activities of daily living, like bathing, dressing, and so on, which is really where most of the long-term care is incurred and the expense for it. Now hospice, Medicare will cover hospice care, but in order to get on Medicare hospice, or to get into hospice, a doctor needs to certify that you have 6 months or less to live. And then Medicare is then going to get out of paying for all the life-prolonging care, which is what most of medicine is, and they're simply going to pay for care to make you more comfortable. So really, you're only going to get coverage in 3 of these places: skilled, home health care, and hospice. And then it's fairly limited coverage with a bunch of rules. I'm Hans Scheil. I've written a couple of books on these subjects within retirement, and I thank you for listening.